There is still a great deal of confusion about hormone therapies. Are they safe and effective in treating physical and mental health changes that happen over our lifetime? Well, I am so excited to be joined by Dr. Jason Burchard, who is the owner of Inspire Medical Wellness right here in Mount Juliet, and Dr. Terri Denai, who is the founder of Avexia's Health Solutions. Thanks so much for joining us on Local 2 today.
Yeah, thanks for having us.
Glad to be here.
I'm so ready to deep dive into this. Dr. Burchard, let me start with you. Talk to us about what hormones are important to be aware of, not only for women, but also for men.
Well, let's first define hormones real quick. Hormones by definition really are the body's chemical messengers, meaning they provide fuel for our cells, and virtually every cell in the body has hormone receptors, so every organ system of the body has to have hormones for proper function. When it comes to, again, the challenge really that we run into with hormones is that due to age and stress and diet, they're gonna start to decline. We're not gonna produce as many hormones as we go through life. And the hormones, to your question specifically, that women, again, are gonna start to experience some deficiency in, and really in the age in which they start. Typically, testosterone's gonna be first, and then usually progesterone, DHEA, thyroid, and then of course estrogen. For men, testosterone, DHEA, thyroid, even estrogen is important for men to a lesser degree, but for heart health.
Yeah. What I love, Dr. Denai, is that you've actually written a book about the subject. So talk to us about maybe what are some of the big fears or maybe even misconceptions about hormone replacement for both men and women.
So many misconceptions, and the book is Hormone Havoc, and it is about dispelling the myths and misconceptions around hormones. And he already said one of the things, and most people don't understand that testosterone is also a female hormone, and we do lose it usually about that, after that second baby, in our 30s for sure. And a lot of the symptoms that happen are really vague, and they're symptoms that women complain about all the time. But some of the other really big misconceptions, and a big one is cancer. Do hormones cause cancer? I dispel all of these myths around testosterone, estrogen, progesterone, DHEA, thyroid in this book, because there's so much misconception. And another really big one for both men and women, especially for women, is that hormones really aren't an issue until we hit a certain age, like 50, and we're having hot flashes. And Dr. Burchard said it very beautifully in that there are hormone receptors head to toe in every single body system. So it's not just about hot flashes, right? It's about so many other things.
Well, Dr. Burchard, talk to me about when people actually come into your clinic, they're complaining maybe of these vague symptoms that may be hormone related. Basically, talk about some of those symptoms and how you help those patients.
So the first thing, obviously, upon doing a brief exam and a history, we're going to start with blood work. We're going to do a very detailed blood panel, and I really hone in on a comprehensive blood panel. And I mention that because so many times when patients come in, and Dr. Terri can vouch for this, almost on the daily, patients are coming in going, well, I actually just had blood work done recently, again, whether it be a yearly physical or through PCP or OB, and they go and they told me everything looks fine, it's normal, but I don't feel fine. They're in our office because they are having, vague or maybe not so much vague symptoms, but a lot of those symptoms, again, are going to start with they're fatigued, they have brain fog, they're not sleeping as well, really mental disorders. They're more anxious, they may be more depressed, they're more irritable, they have little to no libido, and of course weight gain. And we'll talk more about that, but those are going to be your more common symptoms that we typically see when they first come in.
Dr. Denai, you train healthcare providers on this very subject. So talk to me about what are some of the main misconceptions that you run into before they actually are trained?
I think the biggest one is just this concept that, just when a woman gets to a certain age and she starts having hot flashes and things like that, that's the time that you can temporarily give her a medication. And it's this, what we call the allopathic model, and it's how most clinicians in this country are trained. You have a symptom, you treat it with a medication, but really what we're trying to teach them is the impact that hormones play in every single body system and the role in disease prevention. Like he said, depression, anxiety, irritability, mood swings, can't sleep, can't focus, weight gain, joint pain, all of these things are vague symptoms that most clinicians, and I can tell you we've trained OB-GYNs and endocrinologists and cardiologists, every single subspecialty didn't really understand until they came through our comprehensive 2-day training the impact that hormones have on every single body system. And I think that's the biggest thing to overcome, And then the second thing to overcome, of course, is all the misinformation from the Women's Health Initiative trial that really scared a lot of doctors and clinicians and even patients that hormones cause cancer. And now we know that all of those myths have been debunked.
Doctors, I cannot tell you how much I appreciate you all being here and dispelling some of these myths and educating us on the subject. Thanks for being here on Local on 2 today.
Thanks for having us.
Thanks for having us.
I'm going to send it back to you.